we're looking at your left shoulder. I got a shaver coming in through the front. The shoulder's a ball and socket joint. The ball is to the left. Can you just fix that sucker for me, please? Just flip the handle on there. I need a long probe. You got a long probe? The ball is to the left and the socket's to the right here. No, that's good. Just this. I mean, flip that back. Because it sticks. The first time you use it, it sticks. And the articular surfaces look perfect. There's no arthritis that I can detect whatsoever. It looks beautiful. This is a biceps tendon right up above. I'm just going to hook it with my obturator here and pull into the shoulder joint. That little degree of redness on the biceps tendon is absolutely normal. That's a great looking tendon. Behind there is a subscapularis tendon, which makes up one of the tendons of the rotator cuff. And that tendon looks shiny, smooth, and pristine. That's a great looking subscapularis tendon. This is the labrum. There's a little bit of fraying of the labrum right up here, and I will debride that using a shaver. And so I'll take the shaver off, yeah. We're just going to smooth it down a little bit. Not really a lot of work needs to be done in this area, just a little bit of debridement is what we call this. And that's about it. That's all I'm going to do there. I'll take a probe next, please. And we take a look at the attachment of the labrum into the supraglenoid, and that looks like a normal attachment. Nice and solid, not unstable. It looks great, so we're not going to do anything with that. And again, the biceps tendon looks great. So, looking up to the top of the screen, this is the supraspinatus tendon, part of your rotator cuff. Looks a little bit injected, but no tearing that I can detect thus far. And as we go far out laterally here, there's a little bit of partial thickness tearing just right over there. Just hold the camera right there, or hold the arm, I mean. Just right in the center of your screen, on the tip of my probe, that's a small little amount of partial thickness tearing. So I'm going to grab a shaver, and we're going to shave that down, just do the bare amount of, minimal amount of work that we have to here, because I don't want to destroy the normal tendon. We just want to take away some of the tendon that's damaged. That's pretty much it. That's all I'm going to do. So now what I'm going to do is I'm going to look at the tendon from the top side, see how damaged it is. I know on the MRI it indicated that there was some bursal tearing on. So now we're above the rotator cuff, and this is the undersurface of the acromion. You see the CA ligament, and you see how there's some fraying there. So that to me indicates that there is impingement between the tendon down below and the bone up above, and there is going to be a bone spur underneath here. So we're going to take all this down, take the soft tissue down, and go ahead and do the acromioplasty. Now I'm going to work on doing the bursectomy here now. The bursa is the stuff in the foreground. The shaver's on it right now, and we're removing the bursa as we speak. So I finished taking off the bursa. Now I'm taking down the CA ligament, and it's going to expose the bone, the acromion. And then you'll see me come in with a high-speed burr from the lateral side here, from the left side. And you'll see how I grind down some of the undersurface of the bone to give more room between the bone and the tendon. Alright, so we're ready to start the decompression part, or the acromioplasty. The bursa has already been removed. You see this high-speed burr coming in from the left side here. So I use this burr to remove the bone spur. It spins at high RPM, and we just use it to grind away some of the undersurface of the bone here. Not a lot, just about 5 millimeters is all I want to take. Would you turn up the pump pressure to 120, please? 120? Yeah, 120. I'm just going to turn up the pump pressure so I can see a little bit better here. 120? Perfect, thank you. see how much bone I've removed. Looks really good, actually. There we go, we're pretty much done there. You see there's quite a bit more room between the bone up above and the tendon down below now. Just smoothing off the rest of this acromion. I'm doing this with the burr going in reverse because it just makes it easier to buff down the bone gradually. If you put it in forward, sometimes it's really aggressive and it takes the bone away very quickly. And here I just find it a little more controlled. It takes a little bit longer, but I think in the end you get a little bit of a nicer result here. So that's pretty much it. That's the acrominoplasty. Give you that. I just lost my water here. We're going to put it back on again. And I'm going to switch portals. And switch me back to the full radius, please. Just going to look at the acrominoplasty from the side there. So there's the bone, the undersurface of the bone. It's nice and smooth and flat. It has a little bit of an upslope. That is, it's going up to the left there. And there's going to be some bursa still here posteriorly. There usually is. And I'm going to get at that with the shaver coming in through the right side of your screen here. Last bit of bursa here that we are going to remove. See, the fluffy stuff is the bursa. Now I don't want to go too much to the right here because it will bleed. So I just want to take away the bursa that needs to be taken away. I guess is the easiest way to describe it. That's muscle there. That's part of your rotator cuff muscle. And this is muscle here too. So the stuff... That looks great. So we did the bursectomy and decompression. We're all done. That's good.